Okay, so welcome to the next module. This module is going to be on a variety of topics concerning blood. So we're going to talk about just some basics of blood first, and then we're going to move on to talk about anemia, which is low circulating red blood cells. We're going to talk about blood types, and also we're going to talk about coagulation of blood too. So a whole variety of topics. I think it's an interesting module. Okay, so let's look at the function of blood first. So firstly, blood is considered a connective tissue, okay? Um, and 55% of blood is plasma. So when we spin it down in a centrifuge, about 45% is formed cells, which are called formed elements, so formed cells, and about 55% uh, is plasma. Okay, so what are the functions of blood? So one of the main functions of blood is to deliver oxygen to all the cells of the body and to eliminate carbon dioxide. The blood can deliver the carbon dioxide to the lungs for the lungs to then uh, breathe it out. Okay. Delivery of nutrients such as glucose, delivery of hormones circulating in the bloodstream to have an effect on their target organs. Okay, and there's many hormones that we'll talk about in the next module. Blood regulates and maintains body temperature with the skin, right? So all your circulating blood, some of it will go to the skin, and skin can regulate the amount of heat it's giving off by vasodilation or vasoconstriction. Okay, so if your skin blood vessels are very vasoconstricted, you're not going to give up as much heat as if they're vasodilated. Okay, blood is heavily involved in blood clotting. So later on in the module, we're going to talk about platelets, which can form the initial part of clotting, called a platelet plug, and also the coagulation system, which is a series of proteins that can form a very strong fibrin clot. Okay. Regulation of homeostasis is a function of blood. pH, our electrolytes, and blood volume are all regulated in the body. And we've discussed pH before, how important it is to keep it between 7.35 and 7.45. The electrolytes, such as sodium, potassium, calcium, they're all regulated as well, okay, by different means. So, for example, sodium is regulated by aldosterone, for example. Aldosterone increases or reabsorbs sodium. It also reabsorbs water along with the sodium. Potassium is an important electrolyte that's regulated in the bloodstream as well. Blood volume, we've spoken about how aldosterone can increase blood volume, ADH can increase blood volume, and we've also spoken about what happens when there's disorders of ADH, such as diabetes insipidus. When ADH is deficient and you're not able to reabsorb fluid back into your bloodstream, and you urinate it out. Okay, so there's a lot of hormones that are involved in maintaining homeostasis of the blood. Protection from infections. So we have circulating white blood cells, all of which are produced in the bone marrow. They leave the bone marrow and circulate through the blood, and also other parts of the immune system that we'll talk about on an upcoming slide. But definitely blood is heavily involved in protection from infections through the immune system. Okay. Elimination of waste. So that's mainly done through the kidneys. So the blood flowing to the kidneys is able to excrete waste and eliminate it from the body through urine. Okay, there is some elimination in the in the liver, where some waste products can be excreted in bile. For example, some drugs are metabolized more by liver than by kidneys. Okay, so um, when we're talking about drugs, I'm sure you would have heard in pharmacology that this drug is excreted through the kidney, this drug is metabolized, um, and some of it is excreted through the liver in the form of bile. Okay, so but I would certainly think of kidney as the main uh, organ that eliminates waste. Okay, so this slide is showing you a test tube on the left, and it's been spun down in a centrifuge, and now we have the formed elements at the bottom because they're heavier, and the plasma at the top. And it's about 45% formed elements, 55% plasma. When we look at the plasma, well, plasma is mostly water, right? With some proteins in it and some other solutes. So let's just look at them. Albumin, well, that's a very large plasma protein. Globulins, so those would be, for example, antibodies. Those are proteins that are circulating in the bloodstream. Fibrinogen is a protein that's involved in coagulation. In terms of the ions, so we're thinking of all the electrolytes: sodium, potassium, chloride, calcium, phosphate, magnesium, nutrients such as glucose, waste products, BUN and creatinine, the gases, O2 and CO2, and all the regulatory substances such as hormones. Okay, when we look at the formed elements, okay, now we're looking at the three cells: platelets, white blood cells, which are called leukocytes, and red blood cells. And notice red blood cells make the vast majority of the formed elements. Okay, and know the values of the different ones. So platelets, 150,000 to 400,000. Leukocytes, typically at Ameritech we use 5 to 10,000 as a range. And erythrocytes, typically 4 to 6 million. Okay, so let's look at the leukocytes. And remember, we break them down into 5. The neutrophils, which are heavily involved in bacterial infections. And we get an elevation of neutrophils when there's typically a bacterial infection taking place. Lymphocytes, well, they're the main white blood cells responsible for the adaptive immunity. And they often get elevated in viral infections. And then there's monocytes, which have a number of roles, one of them which is becoming a macrophage in all the different tissues of the body. Okay? Eosinophils are involved in allergic reactions, and basophils as well can be elevated in allergic reactions. Okay? Eosinophils can also be involved in infections with parasites as well. Okay? The big ones to know: neutrophils, you get a neutrophilia with a bacterial infection, and we also really care when you have a neutropenia, so a very low neutrophil count, because that opens you up to many, many bacterial infections. Okay, so what's serum versus plasma? Well, serum is just plasma with all the clotting factors that have been removed, or they've been involved in the clot within the test tube. Okay? So look at the test tube on the right. That's exactly what it looks like when you spin it down. Plasma at the top, and then you get this little layer between the plasma and the red blood cells, and that's where all your white blood cells and your platelets are. Okay? And then basically the rest of it is all red blood cells. So the red blood cells really do make up the vast majority of the formed elements in your blood. Okay? So what's serum? It's plasma minus all of the clotting factors. Now this slide I won't spend too much time on. We've already spoken about these. The plasma and the constituents of plasma are in an above slide. The serum being basically the liquid left of the plasma minus the clotting factors is what we call serum. Red blood cells we've spoken about. They are responsible for carrying oxygen. Okay, they're packed with hemoglobin, which is a molecule that's able to carry oxygen through within the red blood cells. Okay, red blood cells are made in the bone marrow, and fetal hemoglobin is slightly different. Okay, in the fetus, they actually have a different hemoglobin that then it needs to transition to normal hemoglobin that's seen in children and adults. So fetal hemoglobin is slightly different, and some is made in the liver and the spleen. Okay. What stimulates red blood cell production? Typically hypoxemia, right? Or release of erythropoietin in the kidneys. And a lack of red blood cells or a low number of red blood cells in the circulation is called anemia. And we're going to talk about a variety of different types of anemia, okay, later in this module. White blood cells, okay, that's the immune system and the inflammatory system. Remember, there's many cells such as neutrophils and then macrophages, which were monocytes in the bloodstream. They're involved in inflammation. Okay, so whenever you see a white blood cell count that's low or very low, it's typically an indication that this person is now at risk for acquiring different infections that can invade the body. Okay, platelets are tiny little cells. They live about 7 to 10 days, and they're little cells that have broken off a larger cell within the bone marrow called a megakaryocyte. And they are the first cells that arrive at a damaged blood vessel, and they form the initial platelet plug that plugs up the blood vessel so it can stop bleeding. Okay, so lack of platelets will lead to ongoing bleeding. Okay, so bleeding into your skin called petechiae, bleeding gums, because the platelets, if they're very, very low, just can't form that initial platelet plug. Or if the platelets are normal, but something is affecting the way that they form the platelet plug, such as drugs, for example, aspirin, non-steroidal anti-inflammatories, the platelet count can still be normal, but those drugs inhibit the platelets from actually forming a platelet plug. Okay, so let's look at some normal laboratory values that we would expect in the blood. Okay, so hemoglobin, remember, carries the oxygen in the red blood cells. Okay, and each hemoglobin, by the way, is made up of 4 globin subunits. Okay, and each globin, so there's 4 of them in hemoglobin, has a heme group. And what attaches to the heme group? Well, there's iron there, okay, and that's where oxygen can attach. Okay, so 4 molecules of oxygen can attach to a hemoglobin since it's made up of 4 subunits. Okay, in females, the hemoglobin levels are typically a bit lower than in males, so 12 to 16. Males, 14 to 18 is acceptable. The hematocrit, remember, what's the percentage of red blood cells in the test tube? That's what hematocrit's asking you. And in females, 37 to 47% of the test tube is red blood cells. In males, 42 to 52%. So again, a bit more for males since they have more circulating hemoglobin. Okay? Red blood cell count in the blood. Well, in females, 3.8 to about 5 million red blood cells. In males, higher, 4.3 to about 5.7. So males just tend to have higher hemoglobins, hematocrits, and red blood cells. The MCV, mean corpuscular volume, is telling us one thing. How large are these red blood cells? Or how small are these red blood cells? And this is really going to matter when we're talking about anemias, because different anemias, different conditions that cause different anemias will give us different sizes of red blood cells. So this will make much more sense when we're talking about the different causes of anemia. Okay, continuing with normal lab values, white blood cell count in the bloodstream, typically 5 to 10,000. Okay, and if it's less than 5,000, we'll call it leukopenia. If it's greater than 10,000, we'll call it leukocytosis, an elevated white blood cell count. Okay? Platelet count, typically 150,000 to 400,000 is your typical blood platelet count. Okay? So you can imagine if you have a platelet count of 50,000, you're going to bruise more easily. You're going to have little blood spots on your skin called petechiae. When you brush your teeth, you're going to likely have bleeding. When you blow your nose, you'll likely have blood within the Kleenex when you've blown your nose. Okay, so platelets are heavily involved in the initial stages of forming a platelet plug to stop little blood vessels from bleeding. Okay, so let's do this question together. The nurse is assessing a patient with a total knee replacement 2 hours ago. Which information requires notification of the doctor? Okay. Bleeding on the dressing is 2 centimeters in diameter. That's totally expected, right? Whenever we have a wound, it's totally expected to have a bit of bleeding onto the dressing. A patient has a low-grade temperature. That's not abnormal shortly after a surgery to have a bit of a temperature. So 2 hours is not long enough to have formed an infection. So typically, if we're going to get an infection post-operatively, it's usually 12, 24, 36 hours later, not 2 hours. Okay? So why do we get a fever after surgery? Well, there's a lot of inflammation happening. That can cause a fever. And that would be the most common. Some people get a post-op fever sometimes because they develop atelectasis. And atelectasis is a condition in your lung where just little parts of the alveoli aren't being ventilated properly, and you can get low-grade post-op fevers after surgery. Okay. If you haven't heard of atelectasis yet, don't worry, we'll cover it in another module or next semester. Okay, the patient's hemoglobin is 6. That's a pretty low hemoglobin. right? For females, it should be at least 12, and for males, it should be 14. So that's a pretty low hemoglobin. Someone should be notified for that level of hemoglobin. The patient voids after surgery, that's okay. That's normal. So it's C.